We are back now with our GMA cover story, a health alert about new research out this morning on a simple blood test that could one day help doctors identify risk of developing heart disease before symptoms first appear. Our chief medical correspondent, who is also a cardiologist, Dr. Narula, got to break this one down for us.
Yes, Robin. So we're talking about BNP, brain natriuretic peptide. This is a hormone that is released by the heart when the heart is under stress. So when the heart sees volume or pressure overload, it releases this hormone to essentially dilate the blood vessels, make you urinate to remove salt and water, and lowers the blood pressure and reduces the heart stress or the heart strain. And we've used this as a lab test. You can check it in the blood, a simple lab test, for the last 20 years, mostly in heart failure patients to help us diagnose heart failure or manage our heart failure patients. But we've learned that this hormone is also released when, for example, people have kidney failure or high blood pressure or irregular rapid heart rhythms or even extreme exertion. So anything that really puts that heart under strain. And so the other thing we've learned, Robin, is that it can also be used to predict future cardiovascular events and even death. Wow. So in this study, researchers looked at about 8,000 individuals who were older, average age of 78. They had no known cardiovascular disease. They measured this BNP hormone at the start of the study and then 3 years later, and then they followed them for 8 years to look for events and death. And they in fact found that in those individuals who had an elevation or a rise in BNP or sustained high levels, they were 6 to 7% at increased risk of cardiovascular events and dying. In addition, the individuals who lowered their BNP were at the same risk of those who had no heart stress. And so it really was helpful to follow that level in this patient population.
Yeah, who should be asking for this test since it already exists?
Yeah, so this is typically not a test. I mean, I'm a cardiologist that we routinely order on all of our patients. It is something that we tend to use in our heart failure patients to see how well we're managing them. And also if someone comes in with shortness of breath or heart failure symptoms, we might check it to exclude heart failure. So as of now, it's not really ready for prime time everyone to use, but certainly it is one more tool that might be available to us if research continues to really bear this out in terms of risk screening. So right now we use risk calculators, we use screening tests like calcium scores, Robin, we were just talking about, as opposed to the BNP.
So you get a test, you get a high score, what do you do?
So yes, if in fact you get a test that somebody orders and the BNP comes back high, in fact this happened with me, a patient was sent to me for this very reason, you would want to see a cardiologist to talk about why might my BNP be high. There can be several reasons, as I mentioned. You would want to talk to them about any heart failure symptoms, and then you'd really want to go through the things we know can reduce heart stress and strain: blood pressure control, cholesterol control, sugar control, exercise, weight, stopping smoking, all the traditional risk factors.
We don't talk about heart disease enough. We talk about other ailments, but we really don't talk about
leading cause of death for men and women.
Right.
Yes.
Thank you.
Thank you as always, Robin.